Hello, my name is Larissa Wiley, PA, and today I'll be talking about my quality improvement project, Pediatric Fluoride Varnish Applications at NOAA Copperwood Health Center. So this project is for the Arizona School of Health Science Doctor of Medical Science program, the Quality Improvement in Healthcare course with Dr. Sandra DePalma. So the aim of this program is that fluoride varnish applications for pediatric patients at NOAA Copperwood Health Center, a federally qualified health center in the greater Phoenix area, would increase by 50% in the next 6 months. Some improvement systems and processes that I used were Lean Six Sigma and the Plan, Do, Study, Act cycle. For Lean Six Sigma, we started to define the initiative by saying that we would increase fluoride varnish applications for pediatric patients under the age of 2 by qualifying providers, of which there are 6 total, 5 family medicine providers and 1 pediatrician, and this would happen over the next 6 months. We'd measure this by hopefully increasing pediatric fluoride application by 50% and analyze it by reviewing the implementation process over the next 6 months. That would be the pilot period. An improvement would be reevaluated on a quarterly basis, and for control, we could weave this into the initiative for the quarterly incentive plan at NOAA, and that would hopefully increase compliance and utilization. The Plan, Do, Study, Act would start with what I just talked about for Lean Six Sigma, and then we would carry it out, study what worked and what didn't work, act on those changes, and then go into another PDSA cycle until it became comfortable and worked well. So why does this matter? So here's the problem. Early childhood caries, also known as dental cavities, is the most common chronic childhood disease in the United States. And caries are 100% preventable, but only 3.6% of children have their first dental visit by age 1. But here's a great solution. 88.8% of children have their first primary care visit by the age of 1, and fluoride varnish application reduces tooth decay by up to 40%. Medicaid and private insurance will actually cover fluoride varnish applications every 6 months until the age of 2, and this can be done by either a dental or a trained medical provider. Some of the costs of caries are that 51 million school hours are lost annually, and $2.5 billion were spent on untreated caries in 2010. In Arizona, 52% of kindergarten-aged children had a history of dental decay compared to the 33% national average, and 28% of this decay remains untreated. But the good news is, like I said, NOAA Copperwood Health Center has 6 potential providers that could apply fluoride varnish and reduce the decay rate by 40%. And in 2019, 9,022 children, that's almost 10,000 children, were treated at NOAA facilities. 52% of those children were part of a racial minority, and 94% were low income. There's no NOAA dentist within a 5-mile radius of NOAA Copperwood, and very, very few dental offices nearby that take Medicaid. So this would be a great initiative. Some of the management skills I used were change management. So I needed to understand the change, plan the change, implement and communicate it, which I'll discuss more later. The stakeholder management is involving the necessary stakeholders, so management personnel, providers, patients, and in this case our patients were very young, so we needed to involve the parents and get them excited and understanding. Time management was also important. One way to chart this is with a Gantt chart. I do have a timeline on the next slide. This is very detailed, but I will break this down into some basic stages. So, basic step number 1 was to email the NOAA clinic manager and then talk to the NOAA Copperwood providers. And I asked what their concerns and feedback were. And then the providers had to complete training at smilesforlifeoralhealth.org. This was mandated by Medicaid in order to be able to bill and get payment for the fluoride varnish application procedure. And then I asked the NOAA supervisor to order fluoride supplies and asked billing about the CPT codes and requirements for compliance. And then I will be demonstrating the fluoride varnish procedure for providers. I was a registered dental hygienist before becoming a PA, and so I want to make sure that the providers feel comfortable applying fluoride for little kiddos. And then we will implement the initiative thereafter and measure the number of fluoride applications 6 months out, so we have a pre and post comparison. and reassess this quarterly, potentially implementing into the incentive plan with a 10% increase in number each quarter. So some value and context frameworks I used were the Fishbone, Value Framework, and Operational Definition Table. Here's the Fishbone. The problem was no fluoride varnish applications for pediatric patients were being done at NOAA Copperwood Health Center, so I looked at the people, process, equipment, materials, environment, and management that would be needed to make this happen. I thought the most valuable was the Value Framework table because it really helped me prioritize things for this project and figure out what was pertinent and what really wasn't. And then I was able to create an operational definition table to see what clinical outcomes would be, what would satisfaction of stakeholders even mean, and what would the costs look like. Here is my reference list. I used 10 different references, and thank you so much for listening.